reason I think we have such a large, we can have such a large effect is because music affects so much of our brain. And I want to be able to access as much as possible. You will see a bit of some melodic intonation therapy that we can. So the whole notion of being stimulated throughout can be wonderful. Music can be used from first cry to last breath. We just talked a little bit about the use of music in the NICU, but Jane Stanley is one of my, I just love this lady. She took, and you can't see this very well, but this child has what they call a PAL, a pacifier activated lullaby is the process that happens. In that pacifier, she has, Dr. Stanley has put in a microchip. Now, these babies in the NICU are usually 2 pounds or less, born much too early. They can't suck, swallow, and breathe with any synchrony. So they're getting choked, they're stopping breathing altogether. And how do we learn or teach them to coordinate that? So what she does is, because if they don't suck, they don't get nutrition. When they suck on this PAL, it activates a lullaby in the room. When they stop sucking, it will last for a short period and then stop. When the baby begins to suck again, the music is activated again. How long do you think it takes a less than 2-pound baby to understand cause and effect and want to suck more? And it can be graduated so they have to suck harder and get more nutrition. Take a guess.
A week?
2 hours a week. That's the
good. Less than 15 minutes.
A music therapist said. Less than 15 minutes. Amazing. I will show you him in a minute because we're going to show all the videos at the same time. Neurologic music therapy is sweeping the country. We long as music therapists for ways to justify or to be accountable for what it is we do. One of the techniques you will see in a few minutes is rhythmic auditory stimulation, the whole notion of using that element of rhythm for our muscle memory. Melodic intonation therapy, you have a person here whose mother I just worked with. The mother has a stroke. It affected her speech, and I tried melodic intonation therapy with her, and I wish you could have seen the look on her face when she spoke the first words. I captured it on the iPad, but I don't know how to transfer it to here. So, but if you want to, you come up afterwards and see it. I'm going to save these because we have to do all the videos together. When the voice is silent, there are people in our cancer unit who have no voice, and I mean that literally. One of the people that came to our cancer center overdosed, and as a result of the overdose, virtually, he was a musician, did a lot of gigs in bars and so forth, but his voice was no more. He was paralyzed from the neck down. And I remember the nurses saying, Gloria, he will tell you what to do. Even though he can't speak, he can mouth the words, and they will not become words. But come and try to see anyway. And I have a way of not looking at you when I don't want to hear what you have to say. So I walked in and did not look at him and said, I hear, Mr. Gurali, that you are a musician. I love working with musicians. I learned 2 songs, and I'd love your feedback. Would you be willing to give it to me? And then I looked up, and his response was, I'll take that as a yes. The idea of what I wanted to do. I said, I have 2 songs. Would you like to hear Stand By Me? How about Sitting by the Dock of the Bay?
They're good song.
What would you
According
like
to
to
who?
Anybody get that? Last thing, I thought this gig playing, overdosing, drug abuser would want to hear. So I took my piano and I started, and by this time there were about 6 nurses, 2 physicians, a social worker, and a couple of people who just walked by and saw something was happening and came in. And I just started singing, and he closed his eyes and began to mouth every word as though he were singing. For thine is the kingdom and the power. And he opened his eyes and said, I said, and who did I come back to see you? It was very painstaking to be with that man for any length of time because everything was demonstrative and angry. But before he left, he looked at me and said, and I won't have my lips through it, don't forget. And I said, I won't forget you. I think a lot of what happens in a hospital with illness is giving a person a voice they want to be heard. All right, I'm going to skip that. We are doing a lot of collaborations as music therapists, and we are doing a lot of research. Pain in particular is an issue. We just completed a randomized controlled trial of 200 palliative care patients. The whole idea was to determine the efficacy of a single music therapy session to reduce pain in palliative care patients. The context was the treatment of pain in palliative care, as you know, is very challenging. We have all kinds of methods that we try. Non-pharmacologic are obviously the safest. So we did a combination of guided relaxation and live harp music. We enrolled 200 patients over 2 years. Literally, we had to approach over 400, but some of them were not suitable. Randomly assigned to 2 groups. One received standard care alone, and the others, of course, a single music therapy session. What measures did we use? We looked at the clinical nurse specialist. We let her assess the pain pre and post. So you had to get her, gave her the scale. She would go in and ask the patient. If they were randomized to the music group, then the music therapist would go in. If they were not, the music therapist would go in